welcome. Today we're talking about acupuncture for fertility, and we are so happy to have Mike Berkley here joining us today. This is such an important topic for us in the reproductive health area. I think all of our patients are looking for any way to enhance their success rates and their experience as they proceed with the treatment cycle. So today we want to talk about acupuncture as a whole, how it can help our patients, any contraindications, and so we have our expert here. I want to introduce you to Mike Berkley. Thank you for joining us today.
Such a pleasure to be here. Thank you.
He is the founder and director of the Berkley Center for Reproductive Wellness. The website is here and will also be in the show notes, and I'll show it to you in a little bit. He's licensed and board certified in New York State and in Chinese herbology by the National Certification Commission for Acupuncture and Oriental Medicine. And he's the first acupuncturist herbalist in the United States to work exclusively in the field of reproductive medicine. So can you tell us, Mike, how you got into this field of reproductive medicine, why you chose to specialize in this? And I'm going to kind of go to your website for a quick second, too.
Sure. So it's great to be here. Thanks for having me on. My wife and I were trying to have a child, and we had some difficulties in doing so, and it wasn't working. And my wife went to see an acupuncturist, an herbalist, and it turns out that my wife had anti-sperm antibodies, and I had poor motility. And the acupuncturist treated my wife with acupuncture, gave her herbs, gave me herbs. And we kept trying, and probably a month or two after treatment, she got pregnant and no miscarriage. And now I have I have a 24-year-old son. And this all happened maybe when I was in acupuncture school. He's 24. I've been in practice for 22 years. I was probably in acupuncture school. So when I was in school, most practitioners are trying to learn how to eradicate pain or treat pain. And I had become very interested in this, in this reproductive medicine subject because of what we went through. And so I decided that I was going to spend, a great deal of time studying both Western reproductive medicine and Chinese reproductive medicine. And that's essentially what motivated me to get into the reproductive medicine scene, if you will.
So you've been doing it for how long?
22 years.
22 years.
Yeah.
I feel like everybody talks about acupuncture now and potentially trying to do acupuncture. I'm not sure what the prevalence is, but back then I don't know that it was something that people would have done. What brought you and your wife to that choice?
So it's always been done, but it just generally wasn't accepted amongst, well, I shouldn't even say that. I mean, I think it wasn't widely thought of for anything except pain management. And certainly when I started to practice, I made it a point to go and meet reproductive endocrinologists to try to network and have them refer patients to me. And all of them rolled their eyes at me. And now today, they refer patients to me. I refer patients to them. There's a big center in New York City, NYU, that has their own complementary medicine team in-house. And so it's very patient-driven now. Patients are asking the reproductive endocrinologist to refer them to acupuncturists. And in fact, remarkably, some reproductive endocrinologists are actually recommending acupuncture to their patients. So it's funny because when I was in school, my teachers would say, when you graduate next year, you're going to be arriving at a great time in the world of acupuncture. And now 22 years later, I lecture at Pacific College of Oriental Medicine every once in a while, just to the graduating class. And I always tell them, you're graduating at a great time because
Right.
it's a lot more accepted and more well known amongst patients and doctors.
Right. So how does it work, so to speak? Can you sort of demystify it for us? We know that it involves some kind of needles or laser, but what do they do? How does it work overall? Not even just talking about reproductive health.
Yeah, it's a good question. So probably everybody that's listening to this podcast has had a transvaginal ultrasound. And what we see in acupuncture is if one does a transvaginal ultrasound with a color Doppler, and what that means is, as patients know, when they look at the ultrasound or they look at the monitor, it's all gray and black and white and fuzzy. But when you use a color Doppler, you can see color on the screen. And so if you do acupuncture on a patient at 3 o'clock in the afternoon, and then you do a transvaginal ultrasound. No, you do a transvaginal ultrasound with a color Doppler before you do acupuncture. You'll see a little bit of red in the uterine cavity. And when you then do acupuncture on the patient and then do transvaginal ultrasound with a color Doppler, you'll see this great amount of perfusion of blood flow into the uterus. And the uterine artery feeds, it breaks off down below it, and it feeds the ovaries. And so what acupuncture is doing is to help improve hemodynamics. Acupuncture, really the mechanism of action of acupuncture is to improve blood flow trophically. So that means if somebody has elbow pain and you put a needle in their elbow, it's going to drive blood to the elbow. And if you put acupuncture needles in the appropriate points in a patient, it will stimulate blood flow directly to the ovaries. And so why is that such a big deal? Well, first of all, let me back up a step. Is that happening already? Of course it's happening already. We have a heart beating. The heart is circulating blood throughout the body. But when you do acupuncture, it improves. Not only does it improve hemodynamics, but it specifically directs blood flow to particular areas in the body. So it's kind of like saying this. Listen, do you exercise? Yes, I do. So what do you do? Well, I walk for 10 minutes a day. Now, that's not the same amount of exercise as what a serious athlete is doing. So the heart beating is stimulating blood, but it's not the same as using acupuncture to drive blood to a specific location. Now that we have that out of the way, so what is the next question? So I've said that we improve hemodynamics to the ovaries or to the testes. So what? So let's stay with the ovaries. So first of all, let's talk about blood. What is blood? Blood is a taxi cab. It's simply a messenger. It's simply a mechanism of delivery. All hormones from the brain get to the ovaries and every place else in the body through the blood. Blood gets rid of debris. Blood goes through the lungs, depositing carbon dioxide and other crap. And when you exhale, you get rid of this stuff. You get rid of this debris. Of course, debris is eradicated through, defecation, urination, sweat, exhalation. But when you're improving hemodynamics, you're improving the delivery of FSH and LH from the brain, oxygen, nutrients, electrolytes, and you're helping to get rid of dead cells from the ovary, which are called debris. You're helping to get rid of debris or a greater amount of debris more quickly than would ordinarily have occurred without the acupuncture. So in a sense, you have this garden, and now you have the opportunity through acupuncture, so to speak, to put more sunshine on the garden and take out the weeds and put more rain on the garden. What's going to happen? You're going to get a more beautiful, robust garden. And to take that example and move it towards the ovarian function, the presumption is, or the end stage, the end goal is to improve egg quality or sperm quality. Because the patients that I see, And probably most patients, unless it's a physical anomaly, don't get pregnant because they're older and they have two concomitant issues. They have low ovarian reserve and diminished egg quality. Now, to set the record straight, women are born with all the eggs they're ever going to have. They lose 1,001 eggs every month. 1,000 die, one is ovulated. If a woman presents with low ovarian reserve, there is nothing in the world today that can increase ovarian reserve. However, acupuncture has been shown repeatedly to improve egg quality. Does it do so all the time? Is it the holy grail? Of course not. But that doesn't mean it doesn't work, because that's kind of like saying, does IVF work? Yes, of course it works. But does it work every time? No.
So let's talk about, it brings up a good point, about the number of treatments, the timing of acupuncture. I think a lot of the early studies that showed a benefit were mostly focused just on the day of transfer. So 2 sessions, one prior to and one post-transfer. I don't know that in the literature there's any sort of ideal or standardization of this. In terms of recommendations, let's talk about like bare bones for a patient who has limited, let's say, time or financial resources versus what you would ideally like for acupuncture for fertility patients. What would your treatment protocol or regimen consist of?
So I'm going to keep the financial part out of it, because it's kind of like saying a patient wants to do an IVF, but she only has $500 to her name. She's not going to be able to do the IVF. So I'm going to leave that out of the protocolization for the time, and just talk about the protocol. So what I want to say, which is important for everybody to know, is that acupuncture is a process-oriented modality. When somebody gets in a car accident or falls off of their bicycle and they haven't broken anything, but their shoulder is completely shot, they have frozen shoulder, they can't move their arm, they go to physical therapy 5 times a week for a month, and then they go 3 times a week for another month, and then twice a week for another month, and then once a week for another month. And at some point along that spectrum, their arm will be better. When somebody's greatly depressed, they don't typically go to therapy once a week. They may go to therapy 2 or 3 times a week. Let's talk about exercise. Monica, do you go to the gym?
Yes.
How many times a week do you go?
3, at least, if I can.
Right. So people will typically go, depending upon the person and their needs and desires, they'll go to the gym between 2 and 5 times a week. Some people go between 2 and 6 times a week, because you're not going to get fit, really, going 1 time per week. Acupuncture is no different than anything else I just mentioned. It's a process-oriented modality. It takes time for this to work. So having said that, I'll give you my protocol. So my protocol is I treat patients twice per week until they're pregnant. And then I treat them twice per week for 13 weeks status post-pregnancy, because 90% of miscarriages occur within the first 12 weeks. So when I get a patient to 13 weeks, I let them go. Now, you mentioned some different scenarios before, so let's go to that. So a patient will call me and they'll say, listen, I'm doing a transfer in 2 days. I would like to get acupuncture. Will it help me? And usually I'll say, probably not. But then I'll ask them a question and I'll say, listen, if God forbid 1,000,000 times this cycle fails, will you subsequently do another cycle? Whether she has frozen embryos, forget the frozen embryo, are you going to do another retrieval and subsequent transfer? So if the patient says yes, then I will suggest to the patient that they come in and start getting treated right away. It's not really to help them with tomorrow's transfer. If they get pregnant with tomorrow's transfer, I'm going to continue to treat them twice a week for 13 weeks to help prevent miscarriage. and I can explain that later on. But if I'm treating them and they do the transfer tomorrow and it doesn't work, then I've already started treating and stimulating blood flow to the ovaries. There are follicles there anyway, and then we'll just continue to treat until they are pregnant, and then we'll continue to treat again for 13 weeks.
So it sounds like that the effects of acupuncture in terms of the blood flow that could increase pregnancy rates are not immediate. Is that accurate?
100% accurate.
Okay. So that obviously we as healthcare providers, nurses, which is what I am, would want to recommend that somebody doesn't just have it around the day of the transfer, that they at least, also too, what I was thinking about this is that you want to have a relationship with your acupuncturist. And I wonder if just meeting somebody as good as they are as a provider the day of the transfer, thinking of having needles when you've had needles all along, even though they're small and obviously much different than syringes, and just kind of being exposed and maybe a little vulnerable in the room the day of the transfer as the first time you meet somebody is helpful anyway.
Absolutely. And listen, I have had situations where patients have come in from out of town and they're doing a transfer tomorrow and then they're leaving the next day. And they want me to treat them pre and post embryo transfer. So I'll do that. There's nothing wrong with doing that. But
Right.
I don't want patients to think, oh, well, I want to use acupuncture, and so all I have to do is get treated pre and post.
Right.
That's not the best case scenario.
You had mentioned treating pregnant patients. Is acupuncture safe in pregnancy?
Yeah, it's 100% safe in pregnancy if the person who's doing the treating knows what to do and what not to do. So it's 100% safe. I mean, there are acupuncturists out there who won't treat a pregnant woman, and that's probably due to their lack of experience. Maybe they've been in practice for 2 years and they're not comfortable, or they're afraid, or they're going to cause a miscarriage, or there's going to be a lawsuit. There's a million reasons why people hesitate to treat. I absolutely treat pregnant women. I think it's huge. I think there are many reasons for miscarriage. One, probably the biggest reason is an aneuploidy embryo, a chromosomally abnormal embryo. And you have your other reasons. You may have polyps in the uterus or fibroids that are causing pelvic distortion that haven't been removed for whatever.
What is the concern with doing acupuncture with a pregnant patient? Can you excessively hit a point that could cause uterine contractions, or what is the concern?
So there are 6 contraindicated points that are not to be used during pregnancy because they can cause uterine contractions. So interestingly, by the way, there's a certain cohort of patients that are 39 weeks or 40 weeks pregnant, and they want help in induction, labor induction. So what you do in that case is you use all the contraindicated points.
Right.
And you put some electrical stimulation on those points, and it starts to make things. It starts contractions. That's quite interesting. So in the patient that you're treating to prevent miscarriage, one obviously wouldn't want to use those points.
Got it.
Now, besides that, I don't really see any danger in treating unless somebody just doesn't know what the heck they're doing and takes a 3-inch needle and sticks it all the way in. I mean, some imbecilic, ridiculous move. But in the hands of an experienced practitioner, everything is going to be fine.
That sounds like that's our answer when our pregnant patient asks us if they can have acupuncture. It's making sure that that person is experienced in women's health, reproductive health. Before we talked today, you had sent me a bunch of studies. Some of them early studies, and they are all pretty optimistic about acupuncture and how it can help both with, there's some of them talked about improving sperm parameters, ovulation in PCOS patients, implantation rates. when I started doing some further research, the more recent studies they have mixed results, because let's say that they're looking at just live birth rates. There was a study in 2017 in JAMA that showed that the live birth rates for acupuncture were not much better than that after treating with Clomid. When looking through these studies, it just seems like they're difficult to interpret. It's very difficult to pretend to do acupuncture on someone, or sham acupuncture. So what is the good control group? Is it somebody that doesn't get any effect? Is there a placebo effect? Are you doing acupressure versus, before you do, if you're doing the sham, are you still doing acupressure? I guess, what are your thought process on the fact that some of the studies are mixed?
Yep, great question. So I can't really speak to the studies because I've actually never done the study or participated in the study. It's just not what I've been interested in doing. But when you say that one study said that acupuncture doesn't yield much better results than doing Clomid, that's actually a huge compliment to acupuncture. Because if Clomid is efficacious and the studies are saying that acupuncture is as efficacious as Clomid, that's not a bad starting place. So that's the first thing I want to say. The other thing I want to say is, studies are always going to be mixed. I mean, let's just jump back into the world of in vitro fertilization. There are multitudinous protocols and multitudinous studies, and some doctors use cetrotide, some doctors don't. Some doctors are now including Clomid in while using gonadotropins. And there's a group in New York City that's very they prescribe DHEA to every single person. So I think that even in vitro fertilization, there's a lot that's still up for grabs, and there's a lot of studies that have to be done. I mean, obviously we know that if you fertilize an egg, look, how many times have you seen patients where they've had an embryo that was tested with pre-implantation genetic testing for aneuploidy, for chromosomal abnormalities, and it has no a very minimal fragmentation. It's just a beautiful embryo morphologically, and it's a euploidic embryo. And you transfer it, and the patient doesn't get pregnant. That's number one. Or number two, she does get pregnant. She has a chemical pregnancy. She gets pregnant, and she miscarries at 8 weeks. Why does that happen? Here's the answer. I don't know, and neither does anybody else. So there are conflicting studies with acupuncture, but the only thing I can say to you is, and I don't mean to sound trite, if that's the right word, or flip. Maybe flip is the right word. Flippant. I don't mean to sound flip, but I really don't care. I really don't care what the studies show. Forget the studies. Here's my position. My position is Western medicine has been around for 200 years. Chinese medicine has been around for 2,500 years. In China, 1,000 years ago, when a woman couldn't get pregnant, she couldn't do an IVF or an IUI or a donor egg transfer, or a donor embryo transfer. She had to do acupuncture and herbs, and it must have worked because there were gazillions of Chinese. So we know that something is happening. We may not know exactly what's happening or why it's happening, but we certainly know that there are tens of thousands of women going for acupuncture who are trying to conceive, and they will tell you, listen, I tried 6 IUIs and 3 IVFs, then I did acupuncture for 6 months, I did another IVF, and it worked. Now, I'm the first one to say, maybe it was just the IVF that worked. Maybe it would have worked without the acupuncture. Who knows? You've heard this case more than once. A patient has done 6 IUIs, 4 IVFs, and 3 donor egg transfers, and none of them worked. She miscarried every time. She and her husband decided they were going to forget it. They're thinking about adoption, but they're not really sure. They go to Hawaii for 2 weeks, and they come back, and she's pregnant. So the world, what I say to patients all the time, is that the world of reproductive medicine is the most uncertain medical world there is, outside perhaps of cancer treatment. If you break your knee or you break your arm, it's very easy to fix. You just go to an orthopedic surgeon and it's 1, 2, 3, it's fixed. If you're depressed, you take an antidepressant, you're fixed. But in the context of reproductive dysfunction and reproductive intervention, what is unknown far surpasses what is known, both on the Western medical front as well as the Chinese medicine front.
You know, ironically, you bring up cancer treatment or oncology treatment, and that kind of brings me to my next point, which is the stress of fertility patients is often equated to that of a patient who has cancer. Unequivocally, studies have shown, and we all know empirically, that infertility patients are more stressed than their age-matched controls who aren't experiencing any kind of subfertility or infertility. What we're not sure about yet is the stress then negatively affecting their chance to conceive? I mean, there's lots of studies. I think that's another one that's difficult to measure. But where the research seems clear for acupuncture, at least to me, is its ability for stress relief and anxiety or control or relief. Would you agree?
So there's a couple of things I want to respond with. Yes, I do agree with what you just said, meaning that I agree with the concept that acupuncture can help ameliorate anxiety and stress. What is confounding to me is the question, does stress negatively impact each and every woman who's trying to conceive? What I think my conclusion is that stress may affect certain patients negatively, and stress may have no negative input on other patients.
I would say that a lot of people, I think, would agree with you. Now, kind of moving on to the fact that our fertility patients are stressed and are always looking for a way to relieve stress, which once they go through a cycle is not, maybe they can't use their normal methods of stress release. So for runners, you know, we kind of take away this high impact activity. For people who like to go home and have a glass of wine, we take away that. How does acupuncture measure up in terms of us offering this as an option to relieve stress for them?
It's very effective. It's very effective. And really, you know, patients get on the table and they just come off the table as if they've had a couple of glasses of wine.
I've had a patient tell me that before. She calls it the acupuncture buzz.
Indeed, exactly. So yeah,
so in terms of stress and anxiety relief, that could be immediate. You know, we talked about the blood flow, you want to get a couple of sessions, but for stress and anxiety relief, even though we want to get a bunch of sessions, that they might feel right away if they feel like they are super stressed out in the midst of a cycle.
The patient will feel it right away with certain exceptions. There are some patients who are very high strung and tightly wound. And you know, you'll put them on the table and they'll be laying there on the table with their eyes wide open, looking at the ceiling. And you know, they're just not going to relax. You know, they're just like, you know, they're just freaking out. So even with acupuncture, you can't de-stress everybody. However, you know, if you put 10 women on the table who are stressed out, I would say it's going to have a really good effect on 8 of them. And even the patient who didn't get stress relief, she'll get it next time. You know, she was nervous. She never had acupuncture before. You know, some guy's putting a needle in her forehead and in her ears. Maybe that's freaking her out. But then the next time, she's already aware that the needles don't hurt, and she may just relax into the session, and that will allow her to have the acupuncture do its thing.
Can you give us an idea, not the first time you meet somebody, but regular sessions about how long they would take?
Oh, absolutely. So with me, it's very formulaic. Every patient is on the table with needles in them for 20 minutes, period.
So how long it takes you, and do you put the needles, are the needles personalized for that particular person? Is there a standardized protocol for, reproductive health? Is it a mixture of both?
That's yeah. The last thing you said was really great. Nobody's asked me that question before. It's a really smart question. In fact, it is a mixture of both, meaning that there are standardized points that I use, but however, if a patient presents with a certain history or a certain body type, the needles will change. If a person is obese or very overweight, you're going to use certain needles that you wouldn't use on somebody who's normomorphic, who has a normal body presentation. If a person has a history of endometriosis, now we know that she has had a laparoscopy, so there's an assumption that she doesn't have any endometriosis left. But that's an incorrect assumption, and she still does, and I'll tell you why in a minute, but I don't want to forget my train of thought. So in that patient, who I know has a history of endometriosis, I'll use certain points that are inflammatory reducing points, because endometriosis, one of the ways it works, one of the ways it helps, cause infertility, besides tubal damage.
So that brings up a couple of things, thoughts for me. So one is that it sounds like, yes, there's certain points, but then you personalize it. And I would expect that every really good acupuncture provider would do the same, because you have the person there and you want to personalize it to them, which make it then difficult to perform a study. So all the more reason for us to sort of go with empiric evidence and not necessarily rely on studies, because you don't have a standard protocol.
I agree with you 1,000%.
Yes. My second thought is, how good is acupuncture in terms of relieving pain? So we have these patients with endometriosis or patients with chronic pain. How, when you first started talking about acupuncture, in the very first 5 minutes, you mentioned pain relief. How good is acupuncture at relieving pain for our patients with chronic pain?
So it's another fantastic question. So I belong to a bunch of endometriosis groups on Facebook, and I'm always on there touting acupuncture. Acupuncture and/or herbs, well, let's forget the herbs for a minute. Acupuncture has an absolutely fantastic effect on reducing endometriosis pain. I just want to get on every Facebook site, every endometriosis Facebook site, and beg those women to get acupuncture. They're always on these sites talking about, I'm dying, I wish I was dead, I'm in so much pain. It's just horrible to see what these women are suffering with. Acupuncture is extremely, extremely helpful. And these women should explore acupuncture, absolutely, because the only hope for them, and there are women that have had laparoscopies that still have this pain. Because if it was just cured of laparoscopy, I just say, well, get a laparoscopy. But there are plenty of women that have laparoscopies and they still have pain. Why? Because they still have endometriosis, because of that normal tissue, right? And so they are destined to live on analgesics, forever. And some of these analgesics are addicting. And so, with acupuncture, you can help the patient reduce the dosage of analgesics, or reduce the amount of times they have to medicate, or perhaps even eradicate the medicine completely. So
give them a better quality of life. A lot of them are missing their first day of work, or the day of the work on their first day of their cycle, I guess I should say, when they're having pain and they, have very poor quality of life for a certain amount of time every month. It can be pretty debilitating.
Absolutely. It's very effective.
So I guess to sum up what we know so far, anything that you feel like we didn't get to mention today, anything that you kind of tell your patients on a regular basis, or you want, infertility nurses, infertility clinicians to know?
Yeah, there's a big one. So remember, most acupuncturists in the world are treating neck pain and back pain. there are not many acupuncturists. There are some, but there are not many that really specialize in reproductive disorders. With your permission, I would like to tell you about a website. But before if you give me permission to do that, well, may I have your permission to do that?
Sure.
Okay, but before I do, I want to tell you about the website. The website is, it's a database of acupuncturists throughout the country who have sat for a board exam. And this board exam is very, very difficult. It's 50% Western medicine, meaning Western reproductive medicine, and 50% Chinese medicine, which means 25% acupuncture and 25% herbs. And I took the test. I'm a member of this board, and I was one of the first members. And I didn't spend 2 seconds studying, not 2 seconds, because I just thought I knew everything. And I went and took this test, and I was very impressed with the difficulty in the test. And so I want to refer patients to this website, because instead of going to this guy down the block who's been just doing neck pain for 20 years, you're better off going with a fertility specialist. So the website is A as in apple, B, O as in orange, R, M as in Mike.org. ABORM.org. And that's the American Board of Oriental Reproductive Medicine. And there are probably multitudinous studies on the website, and there are acupuncturists listed by your zip code. Yeah, that's it. That's it. You know, you can plug in your zip code or your city. There's a lot.
Find the practitioner here.
Yeah, you can find a.
Okay.
It's a terrific website.
That's great.
Yeah, and here's another thing. You know, I've had these occasions, I'm just making this up, but a woman from Wisconsin will call me and say, look, there's nobody here. So what I do with that woman is I do a telephone consult with her, and then I say to her, just go out and find an acupuncturist that you like. I don't care if they're out of school for 6 months. Doesn't make any difference. Just go and find somebody that's across the street. The question I want you to ask them is, will they take my input? And they'll ask the acupuncturist, listen, I want to get pregnant. I'm working with this guy in New York. Will you take his input? And if they say yes, and I design a treatment protocol, and the acupuncturist does the treatment protocol. So I've had occasion to do that, which is very rewarding, because I still get to help the patient, even though there's nobody in her town that knows this work. But anyway, I wanted to mention ABORM. I'm a big proponent of acupuncture, obviously. I'm an acupuncturist. There's one other important thing I want to say. And this is a very personal position that I'm taking and that I'm going to espouse here. There are acupuncturists in the world who treat fertility who absolutely are against Western medicine. They don't want their patients taking these medications and these gonadotropins. They don't want them doing IVF. They don't want them going doing an unnatural route. I think that is utterly nonsensical and stupid and uneducated. And if a patient is having a problem getting pregnant, the first order of business is to see a reproductive endocrinologist. In fact, I will not treat a patient unless she's under the care of a reproductive endocrinologist. How can you tell that the patient's tubes are patent? How can you tell if the sperm is good? How can you tell if the uterine cavity is good? How do you know if she has polyps? How do you know if she has fibroids? How do you know if she has any eggs at all? How do you know if she's ovulating? There's a million things that I can't do and I can't find out. A reproductive endocrinologist is necessary to find these things out. So I believe it takes a village. I believe that the new gold standard is East meets West in reproductive medicine.
Absolutely. I mean, I would have to agree. I think that we would be really remiss to leave out either arm. So the complementary medicine and the Eastern arm, and then the Western arm, which is necessary for the diagnosis and the testing done accurately, as you discussed. So for sure, I would have to agree.
Absolutely. So I think those are a couple of my main points. Absolutely include a Western medical physician in your protocol. Do acupuncture. If you want to do herbs, herbs are efficacious. Make sure that the herbalist is a board certified herbalist. Um, and I wish everybody the best of luck on your journey to family. And you know, it's a very difficult journey. It's a journey for the strong of heart, but stay strong and keep your chin up and go forward, and you will prevail.
Thank you for joining us today, Mike. And so I showed your website. The other